Hi everyone, thank you so much for coming to this video. My name is Sarah. I'm a graduate student at Seattle Pacific University and a registered nurse. Today we're going to be talking about what to do when your child is sick. These are just tips for managing really common childhood illnesses. So before we get started, this video is a part of my graduate studies and it would really help me out if you could just take a minute to complete this survey. It's a 5-question true or false survey that's just going to help me recognize if this video was helpful. So please take a moment, pause the video, go ahead and follow that link. Now that you're back from the survey, let's go ahead and jump in. So we're going to be running through some scenarios of common illnesses that you may encounter with your kids. So the first is you come home from work and your 10-month-old daughter is fussy, she's coughing, has a runny nose, and when you pick her up, she feels really hot and you're concerned she has a fever. So what can you do to help her feel better? The first thing that you can try is give Tylenol or Motrin, or acetaminophen and ibuprofen as they're otherwise known. These medicines are going to help bring down her fever and hopefully help make her less fussy. The next thing that you can do is try to turn your bathroom into a steam room. You're going to want to turn on the shower with hot water and let the bathroom get steamy. Then you're just going to sit in the bathroom with your baby and let her breathe in that steamy air. That's going to help clear out their secretions in their nose and help relax their cough so that they can feel a little bit better. You don't want to put your child in the hot shower because it's probably going to be too warm and burn their skin, but you're just going to sit and hang out in the steamy bathroom and let her breathe in that steamy air. And something else you can try with your babies and little ones is to clean out their nose with either a bulb syringe or a nose Frida. Babies aren't able to blow their nose with a tissue, so we really got to help them out by clearing out that mucus and helping their nasal passages stay open. So both a bulb syringe and a nose Frida help you to get that mucus out. This can be especially helpful right before a baby eats or right before they go to sleep. With a clear nose, your baby's going to eat a lot better and they're going to sleep a lot more comfortably. And it's totally safe to use that bulb syringe or nose Frida multiple times throughout the day, as much as you feel like you need to. So what about honey? Well, honey can be great for a cough or a sore throat. In a child over 1 year old, you can give a teaspoon of honey and help calm down their cough and also help give some relief to their sore throat. But you never want to give honey to a child under 1 year of age because this can lead to a serious illness called botulism. So save your honey for your kids over 1 year old, but definitely go ahead and give it a try when they have a cough or a sore throat. So you heard me talk about acetaminophen and ibuprofen a few minutes ago, and these are really common medicines that can both help bring down a child's fever and reduce pain. So when it comes to fevers, we're not necessarily treating a specific number. If your child's temperature is 102, even 103, and they're totally comfortable, you don't necessarily need to give them medicine. You want to give them medicine if the fever is making them really cranky or they're just saying they don't feel good. That's when you want to give the medicine. So it doesn't matter if their temperature is 100.1 or if it's 103. You really want to look at how they feel, how they're behaving, and then give them the medicine accordingly. Now, they're great for fever, both acetaminophen and ibuprofen, but they're also really helpful for pain. If your child is complaining their ear hurts, their head hurts, their throat hurts, and they don't have a fever, you can definitely go ahead and give these medicines a try. Now, it's safe to give Tylenol to babies over 2 months age and ibuprofen to babies over 6 months. But you don't want to give medicine to a child under 2 months without talking to your doctor first. So we say Tylenol from 2 to 6 months and then Tylenol or ibuprofen 6 months and over. And lastly, did you know that your child's medicine doses are based on their weight? Well, kids grow really fast, which means their doses of the medicine change really fast. So you want to make sure you read the bottle or ask your doctor for a weight-based dosing chart to make sure your child gets the right amount of medicine for how much they weigh. And a helpful hint, if you have Washington Medicaid or Apple Health insurance through the state of Washington, acetaminophen and ibuprofen are usually covered. You can ask your doctor to send a prescription to your pharmacy and you can go ahead and pick it up at no cost so that you have that Tylenol or ibuprofen on hand when your child gets sick. This is an example of a weight-based dosing chart. This one specifically is for acetaminophen or Tylenol. The top bar, that black bar, is different weights in pounds, and then below is how much medicine you give your child. So the light green column is the syrup, the children's Tylenol liquid. The darker green column below is the chewable 80 milligram tablets, and the orange row is the chewable 160 milligram tablets. So if your child weighed 25 pounds and you had the children's liquid on hand, you would give them 5 milliliters. These can be really helpful to have at home, put on the refrigerator, put it in your medicine cabinet so that you know how much medicine your child needs. Most doctor's offices have these available. If you just ask for one, they'll help you out with that. So talking about our little 10-month-old with the cough, runny nose, and fever, when does she need to go in to see a doctor? Well, there's a lot of different things that you can look out for. The first is if your child is really sleepy or difficult to wake up. If your child is just wanting to sleep all day, you try to wake them up and they're not engaging, they don't want to play, they just want to sleep, that's a red flag that there could be something more serious going on, and you should call your doctor or take them to the emergency room or an urgent care if you're not able to get into your doctor's office. If your child has a fever for 3 days in a row, so Monday, Tuesday, and Wednesday, they have a fever every one of those days, they should be evaluated by a doctor to look for another cause of the infection other than just a common cold virus. If your child is really fussy and difficult to calm down, you tried giving the Tylenol Motrin, you tried putting them down for a nap, and they just can't get comfortable, they're really upset, then there could be something else more serious going on and you should take them to be seen by a doctor. Any fever in a child under 3 months old is concerning, and we really want these little babies evaluated if they have any fever. Oftentimes it is just a cold virus, but you want to make sure there's nothing more serious going on with really little babies. If your child is having a lot of pain, so if something is really hurting them, they're really uncomfortable, they're telling you they're in pain, you try Tylenol Motrin and they're still in a lot of pain, there could be something else to consider, and it's important to get your child evaluated and that pain checked out. Fevers, especially high fevers in really young children, can cause a seizure. We think that this is from the temperature rising really quickly, more so than the exact number, but it's still a little unclear. If your child ever has a seizure from a fever, it's important to see your doctor and talk to your doctor about it. And lastly, and most importantly, if you're worried, you as a parent know your child better than anyone, better than any nurse, any doctor. And if you just are really uncomfortable with how your child's looking, you're worried there's something more going on, you should definitely go on in and see a healthcare provider, your doctor, the emergency room, and urgent care. Parents know their children so well, and you often have the intuition that something is wrong, even if there aren't any of these symptoms. So definitely, if you're worried, always talk to your doctor or go in and be seen. So what causes these symptoms like a cough and a runny nose? Well, cough, fever, runny nose, what you may think of as cold, are usually caused by specific germs called viruses. And viruses spread really easily between kids. Kids commonly get 7 to 10 cold viruses a year, which is a lot of cold viruses. They mainly get them from contact with other kids at school, at daycare, on playgrounds, at after-school activities, or their older sibling who's in school brings home a virus and spreads it to the younger siblings. You can encourage your child to wash their hands, cover their cough in the inside of their elbow like this, but it is really hard to totally stop the spread of viruses. So do what you can to encourage your child to wash their hands and be safe with spreading their germs, but don't be surprised if your child is having 7 to 10 cold viruses in a year, especially in the winter months. And because colds are caused by viruses, antibiotics doesn't actually help. Antibiotics only treat infections caused by bacteria, which is a different kind of germ that we're going to talk about a little bit later. So we're going to move on to a new scenario, and this time it's your 7-year-old son. He wakes up in the morning and he's saying his belly hurts. A few minutes later, he throws up, and then he throws up again shortly after. Throughout the day, he has diarrhea 3 or 4 times, and his belly is bugging him. So, what can we do to help him feel better? Well, when your child is having vomiting and diarrhea, the most important thing is to make sure that they're staying hydrated. So, you want to encourage him to drink small amounts of fluid. If your child's not interested in food when they're having vomiting and diarrhea, that's okay. They really only need the fluids, even if it is for a couple days. But if your child does want to eat and has an appetite, you want to try to encourage them to stick to bland foods, things like toast and applesauce. Their bellies are going to tolerate that a lot better than something heavier. You can try putting something warm on your child's belly, like a heating pad or a washcloth that you soaked in warm water and then wrung out. That warmth can help with any of the cramping that they're having that's causing their discomfort. And you can try giving Tylenol and ibuprofen to help with any belly pain that they're having as well. So what kind of liquids are the best choices when your child's having tummy troubles? You want to try to stick with clear fluids as much as you can. Things like chicken broth, Pedialyte, diluted apple juice, water. These are going to be the things that they tolerate the best. If your child only wants to drink milk and that's absolutely the only thing that they will take, probably better than not having anything. But if you can get them to do a clear liquid, that would be the first choice. And what I mean by clear liquid isn't necessarily something clear like water, but a fluid that if you held the bottle up in front of your computer screen or in front of your phone, you'd still be able to read the words through it. If your child is really giving you a hard time about drinking fluids, you can try popsicles. Those also count as a fluid. So to make dilute apple juice, you can do half apple juice, half water. So for example, pour half of a cup of apple juice and half of a cup of water into your child's glass and give them that. And the reason you want to dilute the apple juice is when your child's having stomach troubles, you really want to try to avoid fluids that are high in sugar. So things like soda and juices have a lot of sugar in them, and that sugar can actually make the diarrhea worse. Even ginger ale, which ginger can be helpful for tummy troubles, but the ginger ale has too much sugar in it, and you really want to try to avoid that much sugar. Child is having an upset stomach, they're vomiting, they're having diarrhea. It's really important to encourage them to take their fluids slowly. If your child is older, you can just encourage them to take one sip, take a break for a few minutes, and then have another sip. In your younger children who can't regulate themselves quite as well, you can do 1 tablespoon of fluid every 5 minutes for 20 minutes. If they're able to keep that tablespoon every 5 minutes for a 20-minute total down, then they're probably keeping enough fluids in to stay hydrated. So what that means, let's say you start this process at 10:12 a.m. You give them 1 tablespoon of apple juice at 10:12, and then you wait 5 minutes. Give another tablespoon at 10:17. Wait 5 more minutes. Give a tablespoon at 10:22. Wait 5 minutes. Give a tablespoon at 10:27. Wait 5 minutes. If they're able to keep all of those down, then your child is probably getting enough fluid to stay hydrated. So how do you know if your child is dehydrated? It's the biggest thing that we want to look out for when a child is having vomiting and diarrhea. And these are some of the things you're going to keep your eye on. You want to look at how much your child is peeing. If your child goes 8 hours without having a wet diaper or going to the bathroom if they're potty trained, then they're probably not getting enough fluid and you need to take them to be seen by a doctor. If your child cries and they don't have any tears, or if the inside of your child's mouth looks really dry and their lips are dry and cracked, these are all signs that they're not getting enough fluid. So when to go to the doctor? If your child's belly pain is severe, if it's constant, they can't get comfortable, they don't want to walk, then there might be something else going on and you should take them to be seen. Any of those signs that we talked about for dehydration, then you want to be seen by a doctor. It's better to go in earlier when there's any concern for dehydration than later on once the dehydration has gotten more severe. If your child's vomit or diarrhea has blood in it, then they need to be seen by a doctor. When you see blood and vomit or diarrhea, it might look like the blood that we're used to seeing when you cut your hand, for example, and you see that bright red blood. But it can also look very black and dark, almost like coffee grinds. So that is also another sign of blood and that you want to be seen by the doctor for. And then, like we talked about, if your child's not able to keep down that 1 tablespoon of fluid every 5 minutes for 20 minutes, you'll want to take them in to see the doctor so that they can help manage the vomiting. So the last thing that I really wanted to talk to you about is antibiotic safety. So kids commonly get illnesses from 2 different types of germs, viruses and bacteria. Viruses cause the common colds, the tummy troubles that we were just talking about, most of the illnesses that kids get. But sometimes they have illnesses that are caused by bacteria. When an illness is caused by bacteria, we're able to treat it with antibiotics. So some of the most common reasons kids need antibiotics are things like ear infections, urinary tract infections, or UTI, pneumonia. These are illnesses that are often caused by bacteria that need to be treated. So when your doctor prescribes antibiotics for your child, it's really important that they take all of the medication. The whole bottle, as the doctor prescribed, is what you want to aim for. So if the doctor prescribed medicine to be taken twice a day for 10 days, you really need to take it for that entire 10 days. If your child feels better on day 4, that's great. And that definitely means the medicine is working, but you need to keep on going and finish that whole 10 days. Second tip for antibiotics is you never want to give antibiotics that were prescribed for someone else or even for that same child but a different illness. We don't know that antibiotic that they were previously prescribed treats the bacteria that they have now. So not all antibiotics are the same. Different antibiotics treat different kinds of bacteria. And if your child's ear infection may be caused by a specific bacteria, but their urinary tract infection is caused by something completely different. So you never want to use old antibiotics. You want to go in and see your doctor and get a new prescription if they have an illness that requires antibiotics. Lastly, if your child is having any side effects from antibiotics, it's really important to talk to your doctor. So things like diarrhea and rash, sometimes it means you need a different antibiotic, and sometimes there's just something that your doctor can do to help alleviate those side effects. So don't hesitate to call your doctor if your child's having side effects from an antibiotic. Thank you so much for watching this video. Lastly, before we go, I have one more survey. It is another 5-question true or false survey. Please pause this video, click the link, and go ahead and answer that survey. Filling out both of the surveys is really going to help me know if I did a good job in this video. So thank you so much for watching. If you have any questions, feel free to email me at spuwellness@gmail.com. I'll be answering emails at this address until July 1st, 2020. Or you can talk to Anthony Barnes at the Salvation Army White Center for any more questions you have after that date. Thanks so much for watching.